I am Lars Freisberg and I practice with Tulsa Retina Consultants in Tulsa, Oklahoma. We have a practice with 4 physicians, and on average we see approximately 25 to 30 patients a week that require laser treatment and for which we use the Navilas. Over the past years, we've seen a substantial increase in our patient population with more severe diabetes, and the management of these treatments have become increasingly time-consuming. So we were looking at an option that allowed us to have a better flow of these patients and to allow them a treatment that is comfortable and also cognizant of their time. Ever since we had the Navilas, we have substantially increased the amount of so-called pan-retinal photocoagulation lasers. These treatments are time-consuming and for a lot of our patients also uncomfortable. And having had the ability to use the Navilas has increased patient compliance and has made it easier and more comfortable for them to go through multiple sessions through both eyes. We feel that that is the main reason why we're seeing more patients returning for their treatments. Since we've had the Navilas, we are using the infrared very often to monitor our treatments. This makes it much more comfortable for the patient since we're not shining a bright light in their eye. We use the quick switch function in between to see if we have good tissue application, and then can go back to the infrared to monitor the treatment without having to bother the patient with a bright light. This has been very helpful for both the pan-retinal laser as well as the focal laser for us to use. For many of our patients, seeing still is believing, so the ability to show patients their pathology right there on the laser has increased compliance and also makes them more likely to return for ongoing treatment. In our practice, once we had the device available, myself and my partners felt that the ability to pre-plan and to lay out the treatment options for us has made it faster because we can use our ancillary staff and our laser assistants to help us get things going faster. We have the ability to interface the Navilas with our electronic medical record system, and that has substantially increased our ability to cut back on documentation time. And of course, the ability to upload that electronically takes away transcription errors and other problems and makes everything immediately accessible to myself and my partners. The Navilas has been worthwhile for us in many different ways. Initially, we saw it as a way to increase patient compliance and also to offer a treatment that was not available, such as the non-contact focal laser. But for us, it also increased the general enjoyment because we can offer a treatment that make our patients more compliant and more likely to return for good quality care. At the end of the day, of course, we are an enterprise and we have to look at the numbers. And we did that after 1 year of the Navilas, and we saw that our procedures in regards to pan-retinal laser had increased so substantially that essentially the device paid for itself within the first year. And this was not something we had set out to do. This was an inadvertent finding that we had after 1 year. Ever since we've had our Navilas, we've had a good relationship with the company. We feel that this device still is nowhere at the end of its potential, and hearing what is in the pipeline has made us very excited that this was the right decision for us.